Hi, my name is Heba Tallah Mohammed. I'm Director of Research and Clinical Innovation at Swift Medical, which is a digital wound care platform. I oversee research and evaluation aimed at demonstrating how advancement in digital healthcare can result in gains in clinical workflow, care quality, and cost effectiveness. Recently, we published a study with the title of Clinical Operation and Economic Benefits of a Digitally Enabled Wound Care Program in Home Health, a quasi experimental pre post comparative study in the Journal of Medical Internet Research Nursing. In this study, we partnered with CenterWell. It's one of the largest home health enterprises in the US. The objective was to evaluate the real world impact of adopting a digital wound care platform, Swift in this case, um, at the organization. So we compared some clinical and operational outcomes prior to and following Swift implementation throughout 14 of the enterprise's branches. We also used 27 non adopting branches as control. Overall, we had over 14,000 wound care patients were included in this study. And here's what we found. We found that branches that adopted Swift was able to see 1.5% more complex wounds. And with that, they still achieved a 14% net improvement in healing rates compared to the control group. Also, CenterWell experienced a 4.3% reduction in skilled nursing visits per 60 days episode. If we look at the control branches, they saw a 4.5% increase. And what does this mean? That means that over 1,100 visits have been avoided, translating into a potential cost savings. So if we look at the projected cost savings in this one example, tied to only the visit optimization alone, it's up to 1 million in projected annual savings across the organization. Um, in the study, we also found that the clinicians experienced 2.5% time savings per visit. That's a total of saved 309 staff days per year, just with the shorter visit duration. And for the healing time, it was faster. So wounds closed 4.3 days sooner than it should be, or it would be, 15.7% improvement. Comparing to the control group, they only saw 1.6 days faster. This was typically special for or significant for pressure injuries, venous ulcers, and also surgical wounds. And we all know that faster healing means less pain, lower risk of complications, and quicker return to daily life routine for patients. So, in other words, the digital healthcare platform, Swift, uh, with it, the clinicians were able to spend less time per patient, but at the same time, they achieved better outcomes even in high equity populations. And why does this matter? To our knowledge, it is the first study to examine the impact of wound care technology adoption in a large home health enterprise. So it provides real world data, objective evidence that a wound care platform, a digital wound care platform like Swift, can improve the healing outcomes, can reduce the clinician burdens, and also deliver measurable cost savings, all while keeping the mission, which is better care for the patient and better operational efficiencies. We chose to submit our publication to the Journal of Medical Internet Research Nursing because we wanted to reach out to wider audience. So instead of just being focused to the academic circles to share our findings and disseminate our finding with them, we wanted to reach to the decision makers in policy, operations, and innovation. Also, the GMIR has an open access model, digital first platform, and also strong reputation in applied health informatics. So it all made it the right home for this study.